So again today, I'm pleased to report that there are no new confirmed cases of COVID-19 in New Brunswick. Our total number of cases remain at 118, of which 102 are now considered to have recovered. But we are not through with this virus yet. We are continuing to look for new cases of infection, and we have increased the scope of testing to locate as many infected people as possible. So I encourage you to call 811 if you have 2 of the 5 symptoms that we are looking for testing purposes. Until there is an effective vaccine or other form of treatment, we will continue to test for COVID-19 infections. It is very, very important. This portion of our work from a public health perspective is extremely important moving forward. So we will continue to urge those with symptoms to contact 811 and follow the directions you are given. This pandemic has created stress and anxiety for everyone. If you have been tested for COVID-19 and are awaiting the test result, the stress is even greater. You know, that 24 or 48-hour period or even longer that you're waiting for that test result causes a great deal of stress. So we want to help reduce that stress involved in obtaining test results. With the support of Canada Health Infoway, effective today, the Department of Health is launching the My Health NB website. So this is a web portal, and it will provide secure access to test results for any eligible New Brunswicker that has been tested for COVID-19 at an assessment center. So you're provided with information there on how to sign up and how to access your test results, and it's really, really a wonderful tool. So instead of waiting for the phone to ring, you can access your personal test results on your mobile phone or home computer as soon as it becomes available. And someone was asking me, well, aren't you still going to get a phone call from Public Health? What if your test is positive? Of course you will receive a phone call from Public Health if your test is positive. So the good news is right now we're testing between 300 and 400 or 500 people a day, and obviously all of those tests are coming back negative. So all those people that would be waiting for those results are now going to be able to access them online. So that is a really, really great tool. It's great for our human resources in terms of what other functions that they can be performing. So if you received your test on or after April 20th and you were provided with your unique registration code, you may register for a My Health NB account to check your own COVID-19 test result online at myhealth.gnb.ca. You can check your result from home when it has been processed, usually within 24 to 48 hours. If your test result is positive, the site will provide you with information on self-isolating and other means to prevent the further spread of the virus. The site will also show when a test result is negative for COVID-19 or when a test is inconclusive. If your test is positive, you will be contacted by Public Health and there will be regular calls to monitor your condition. Grâce à l'appui de l'Inforoute Santé du Canada, le ministère de la Santé du Nouveau-Brunswick lance dès aujourd'hui le site web Ma Santé NB. Ce portail web permettra aux citoyens admissibles du Nouveau-Brunswick qui ont subi un test de dépistage de la COVID-19 à un centre d'évaluation d'avoir un accès protégé à leurs résultats. Au lieu d'attendre un appel téléphonique, ils pourront désormais obtenir le résultat de leur test à partir de leur téléphone ou de leur ordinateur dès qu'il sera disponible. Alors, ça va sauver beaucoup de temps et ça va sauver beaucoup de stress. Si votre test a été effectué le 20 avril 2020 ou après et que vous avez reçu un code d'enregistrement unique, vous pouvez créer un compte Ma Santé NB pour vérifier vos propres résultats à un test de dépistage de la COVID-19 en ligne à l'adresse masanté.gnb.ca. Vous pouvez obtenir vos résultats de la maison dès qu'ils ont été traités, soit habituellement dans un délai de 24 à 48 heures. Si le résultat du test est positif, le site vous fournira des renseignements sur l'auto-isolement et de conseils sur la façon de prévenir la propagation du virus. Le site indiquera également si le résultat d'un test de dépistage pour la COVID-19 est négatif ou non concluant. Si le résultat de votre test est positif, vous recevrez un appel du personnel de santé publique qui vous appellera régulièrement par la suite pour s'informer de votre état de santé. I know the time between taking a test and getting the result can be filled with anxiety and stress. This innovation is designed to take away some of this stress by giving people quicker access to information that will benefit them and their families. And again, it's also great for the human resource side in terms of freeing up the time that it would take to call back the hundreds of people who we are testing every day. At times like these, we all need to be able to reach out to others. The COVID-19 crisis has made it difficult to physically reach out in times of need. But remember, you are not alone. Help is just a click or a phone call away, and that we can find new ways to maintain our ties with our families and communities. The virus is here, and it's not going away anytime soon. By continuing to do what we are doing, we can protect those in greatest need of protection and ensure that our health system can respond to any new challenges that arise. We are getting through this together, and I'm confident that we can continue to do this together. Thank you. Merci. Oh, I just have one thing to add. Sorry, Premier. I did have a call about the information that we provided yesterday about the work camp in northern Alberta at Carroll Lake. So there is one case of somebody from New Brunswick who has been infected with COVID-19, but that person is isolating in Alberta at the camp. But the request that I had today in terms of an email were questions around what about spouses or relatives of people who have come home from the camp and then gone back to Alberta. So our 811 staff are aware, and they are willing to take they're able to take any calls or questions around that. So we encourage you to call 811, and they can let you know what you should be doing. So basically what we know is that anyone who attended or worked at the site during the period from March 19th to April 16th should self-isolate themselves and watch for symptoms for 14 days. But again, you can call 811. They are aware of the situation and they can help answer your questions. So I think that's it for now. Sorry, Premier. Thanks.
Good afternoon. Bonjour. Over the past month, we have asked a lot of New Brunswickers. We've asked you to stay at home as much as possible. We've asked you to avoid visiting friends and loved ones who are not part of your household. We've asked you to put your lives on pause for the greater good. Parce que vous suivez les directives de la santé publique et que vous avez accordé la priorité à la santé et à la sécurité de vos concitoyens, en tant que province, nous avons été en mesure de limiter la propagation de la COVID-19 jusqu'à maintenant. Thanks to your hard work and sacrifice, we are now in a place where we can determine what recovery for New Brunswick just might look like. Planning is still in the early stages, but we will be discussing New Brunswick's recovery this week at the all-party cabinet meeting. D'une certaine façon, il a été facile de tout fermer. Toute rouvrir va être plus difficile. On ne retrouvera pas notre routine habituelle avant un bon bout de temps. We must reopen our communities and our province methodically and gradually to ensure that we do not set ourselves back. Although new cases are minimal and more people recover every day, as a province we are still surrounded by COVID-19. And we are vulnerable to what happens in other provinces. Because of this, we can expect that our borders may remain closed for some time. This is still a critical time, and we need to remain diligent. Si vous êtes sorti de la province, peu importe la raison, vous devrez toujours vous isoler pendant 14 jours. Even as we begin to slowly reopen, businesses and individuals will need to adapt to a new normal. We will need to maintain physical distancing. Proper sanitizing procedures must be in place. Les employés pourront avoir à porter des masques. Les commandes en ligne, la collecte sans contact et la livraison devraient être envisagées ou devraient se poursuivre dans la mesure du possible. Businesses must look at a new way of operating as we gradually reopen across our province. We will not force any business to reopen before they are ready. In fact, it is imperative that they are sure they can protect employees and customers before they do so. Just because we announce a sector can open, that does not mean every business in that sector will be ready to open its doors the very next day. I will share further details as soon as I'm able on what the next several weeks and months may look like. Ce sera une nouvelle réalité. Nous devrons procéder lentement et nous devrons être prudents. Nous avons été chanceux au Nouveau-Brunswick, mais nous ne devrons pas tenir cela pour acquis. This is a National Volunteer Week, and I want to take a moment to thank the people who are finding ways to give back while obeying physical distancing rules. The pandemic has had a serious impact on the important work being done by nonprofit organizations in our communities. Much like businesses that are not providing essential services, many of these nonprofits are closed. They're not able to deliver the fundraising or fee-for-service programs that they would have normally provided them with some revenue. That's why, for 2020-21 fiscal year, our government has added a new category through the Community Investment Fund to support nonprofits impacted by COVID-19. This funding will support small to medium-sized nonprofits that have been affected by the pandemic with grants between $500 and $10,000. This assistance is designed to address gaps within the existing support being made available by our federal government. Les organismes sans but lucratif et les groupes communautaires du Nouveau-Brunswick jouent un rôle clé dans la création de communautés dynamiques. Et ils vont vous aider à relancer notre économie après cette pandémie. J'invite les résidents qui ont les moyens de le faire, de continuer à appuyer ces organismes autant que possible. Application forms for this funding are available through the Regional Development Corporation's website. We will continue to do what we can to support businesses, nonprofits, and individuals as we begin the process of slowly reopening. It's important that we all continue to work together. We must continue to follow the directives of public health. We must continue to be resilient and to care for one another. We will get through this together. Thank you. Merci.
Thank you, Premier Higgs. Thank you, Dr. Russell. Merci, Monsieur le Premier ministre et Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. We will now proceed with questions from the media. You have the right to pose the question in the language of your choice. Tom Bateman, Times and Transcript.
Yeah, good afternoon. I have some questions about the pending spring fisheries in the province for both the Premier and Dr. Russell. I wonder if you're both confident in the seafood processing sector in this province and their ability to safely operate in light of serious outbreaks we've seen at other protein facilities across the country, and even concerns expressed by some of the processors themselves about their ability to operate their plants safely. And then specifically for Premier Higgs, just if you could comment on what communication he's had with federal ministers and ministries about any potential changes to spring fisheries in this province. Thanks.
We have actually talked directly with certainly the Prime Minister and certainly with the Deputy Prime Minister, and in relation to our calls nationally with other premiers about the opening of the fishery, and that was related for New Brunswick and PEI particularly around the processing plants not being ready to be up and running. And so we were looking for a delay up until, let's say, starting May 15th at the earliest. We will require the processing plants to respect the rules and regulations of public health, following obviously the social distancing, but following the required equipment as necessary for protective equipment or clothing. This masks. So the idea is that they will have to find a way to meet the guidelines to operate safely, and we're hoping right now that would be not start until May 15th to give a little window for them to get up and running, and also to get the employees lined up to go to work.
Do you have anything? Thank you, Premier. Mr. Bateman, do you have a follow-up question?
Yeah, again for the Premier. I'm just interested in the temporary foreign worker aspect of this question as well. I know you've expressed some hope that some sectors could employ more New Brunswickers than than temporary foreign workers this season. Are you aware of TFWs coming in specifically for the fisheries? And if so, how many and where are they going? And how will you keep them and the communities they're going to safe? You know, specifically around the risks that they may pose.
So any requirement, I mean, it does have to be managed federally. Each province has to do work with the federal government directly. We had looked as Atlantic provinces at one time that we might be able to have, you know, a group come in and isolate in a particular province for the 14 days and then move into their respective jurisdictions. That's not going to work, so it has to be each province that would actually do their own thing with the federal government. So right now, I'm not aware of the numbers, but I am certainly aware of the process. So if foreign workers do come into the province, they must isolate for 14 days before they are available to go to any work site. And we are working with our own people and working in conjunction. I've had these discussions directly with Deputy Prime Minister Freeland in relation to how do we coordinate maybe the programs that currently exist, whether it be EI or social assistance, and how do we work and top up the wages? How do we work for people that are on a federal program right now that are out because of the federal compensation, which is some people are finding it hard to get companies or plants are finding it hard to get people back to work because the federal program has basically allowed many people to leave the work site at this point. But it was always intended, and the federal program was no different, that if someone left the workplace, they had to be such that they weren't able to meet the public safety standards that were put in place and the health standards. And otherwise, they're expected to be able to work if that workplace is running and can meet the public health standards. We have a mechanism in place where WorkSafe will evaluate. We have compliance officers to evaluate. So if anyone feels uncomfortable in their workplace, then they have a right to recognize that and to formalize the process to have it evaluated.
Thank you, Premier. Thank you, Mr. Bateman.
Thank you.
Mia Yerkart, CBC.
My questions are for the Premier. New Brunswick's so-called snitch line has been up and running for a month now. Can you tell us the number and the nature of the calls received?
I can tell you the nature of the calls, and I can tell you that there were many calls. The nature was basically in case of non-compliance and concerns about the social distancing practices, or let's say mass gatherings or gatherings just of numbers outside of family. And you know, it's never easy, but it's a helpline as well. I mean, we've seen many calls been diverted there to just get information on in relation to the COVID-19 or the situations that arise in the province, or for clarification on particular issues, or for identification of particular violations. So it's had a multiple effect and a multitude of uses, but it's I think has served a purpose here during this pandemic, and it's allowed us to have you know, more people out in the communities helping to protect each other.
Thank you, Premier. Do you have a follow-up today, Ms. Yerkart?
I do. I spoke with a woman this morning who called the line 3 times, and nothing was ever done about the issues with her neighbors. No one responded. She was told that the information is put into a spreadsheet and that's it. So can you please describe the process of what happens to calls and whether there's any follow-up? Well,
there's certainly a follow-up, or why would we ever put it in place? So, I mean, I will follow up in this particular case, and if the I guess lady would like to contact me directly, my email's pretty standard, blaine.higgs@gnb.ca, and I will follow up, because these calls are used to have, as I said, more visibility into our communities. You know, I appreciate the individual, you know, making a concerted effort in this case here, as you indicate 3 times, but it's more than a spreadsheet. It's are we seeing trends? You know, there could be isolated incidents, I think is fair to say, but do we see trends? Do we see community trends? Do we see issues around the province that then I would bring up either through here, or public safety would bring up, or public health would bring up? And I can't speak to this particular situation because I don't know to what it entails. But certainly, I will respond.
Thank you, Mr. Urquhart. Michel Corriveau, Radio-Canada.
Oui, bonjour. J'ai une question qui touche aussi à la pêche. La pêche au crabe devrait commencer vendredi. Comme vous savez, le retour en usine, donc, pourrait se produire dès la semaine prochaine, dès lundi prochain. J'aimerais savoir, Dr. Russell, est-ce que la santé publique est satisfaite des mesures de sécurité et sanitaires prises dans les usines de transformation de crabe?
Pour la pêcherie, l'information que j'avais reçue, c'était qu'il y avait un délai jusqu'à le mi-mai. Et l'autre information que j'ai, c'est si n'importe quel emploi qui va se faire avec, il faut falloir suivre les directives de santé publique.
M. Corriveau, as-tu suivi cet après-midi?
Oui, merci, Bruce. C'est sur le même sujet, mais cette fois-ci pour le Premier ministre, M. Higgs. Donc, Monsieur le Premier ministre, j'aimerais savoir, plusieurs de ces travailleuses et travailleurs dans les usines de transformation de crabes et de homards, les transformations de poissons, plusieurs de ces travailleuses et travailleurs ont des enfants d'âge préscolaire, mais aussi de jeunes enfants d'âge scolaire qui vont à l'école. Qu'est-ce qui est prévu pour ces travailleuses et ces travailleurs quand la pêche va reprendre et quand le travail en usine va reprendre, s'il le reprend, pour le crabe spécifiquement la semaine prochaine?
So in every community, as with the actual requirement for families and for daycares, and we have a system. We passed some legislation just this week in relation to allowing school buildings to be used as daycares if needed. And we just need to identify that, and I believe there's a number on our website, or there's a number on the education website, but there's connections, so we just need to know what's required, and can we fill it with current daycares that are available, or do we need to set up a daycare in the school facility? Because we'll do one of two things to allow people to get back to work.
Merci, Merci, M. Corriveau. Vicky Hogarth, Charlotte County TV.
Thanks, Bruce. My first question is for the Premier. Premier Higgs, many rural parts of New Brunswick have populations that double and triple in the summer months, and many of these summer residents come from other provinces, and some even wish to return to New Brunswick earlier this year given the current circumstances. Can these seasonal residents who come from other provinces return as they wish, given that they own properties? And if so, do they have to submit some kind of formal self-isolation plan for approval?
So we are not there yet to let out-of-province individuals return to their summer residence. If it's people that live in New Brunswick, I mean, we have cases where people are in the south. They actually, are from New Brunswick. They live in New Brunswick, but they go to the south in the winter, and then they come back and they have either recreational properties, one might, or their summer residence, and they or of one type or another. I mean, that is one situation we're looking at. The other situation is looking at, the ability for people in New Brunswick to move and to go to their camps or cottages and be able to do that. And that's a discussion that we're having today is, what movement can we have within our province. But to say at this point in time that we would even consider someone from another location, another province, another country, to come here at this time with their, and just to come here because it would be a good place to come at this point in time. New Brunswick's always a good place to come to. But right now, I think that is going to require special consideration. We'll work with public health to determine the protocol around that if and when it's possible. But right today, we're looking at what can we do for New Brunswickers who are in our province, who are coming back to our province because they live here. And how do we manage that as we move forward?
Thank you, Premier. Ms. Hogarth, do you have a follow-up question today?
I do. Thank you, Bruce. It's for Dr. Russell. Dr. Russell, outside of testing staff and residents with COVID-19 symptoms in nursing homes, how else are you proactively monitoring for potential outbreaks in long-term care residences?
Well, certainly they would be on a priority list to get tested very quickly. Right now, we are working with both health authorities as well as social development on making sure that everything that can be in place is in place to make sure that they are able to respond really quickly and have all the resources and information necessary to respond. We have a working group on vulnerable populations, and they have been doing an enormous amount of work in conjunction with the RHAs and social development, again, around making sure that whatever gaps there are, whatever pieces of information need to be transmitted to each and every nursing home in the province, that they have access to that information. They've also reached out to all the family physicians who work with the nursing homes, again, to make sure that they have all the right information that they need, documents around PPE, documents around proper use of that, proper isolation, protocols, etc. So there's a lot of work being done right now, but make no mistake, this is a highly vulnerable population, so we are taking it very, very seriously. We have seen what has happened in other provinces and jurisdictions, and it's quite devastating. So we would not want to see that happen here in New Brunswick. So all the steps that we can take right now, we are trying to take, and whatever extra steps that we need to take, we are definitely discussing that so that we can offer the best protection to nursing home residents at this time, including making changes around staffing to make everything as safe as possible. This is very difficult for residents as well as the family members of residents right now in terms of not being able to visit. So I know there are pieces of that are being worked on as well. I know for non-COVID positive palliative patients, social development is working on making changes around that kind of visitation. So so again, we know this is very, very difficult and stressful for the clients themselves and for their family members, but taking into account how high risk and how vulnerable this population is, we are really focusing on protecting them.
Thank you, doctors. Thank you, Ms. Hogarth. Matthew Wacomo, l'Acadie Nouvelle.
Bonjour, au sujet du site web dont il a été question un peu plus tôt durant la conférence de presse, Ma Santé NB. J'aimerais savoir quelles mesures ont été prises pour assurer la protection des renseignements personnels des Nouveau-Brunswickois qui pourront accéder à ce site-là.
Alors ça, c'est un projet qui a commencé dès que la pandémie a commencé au sujet d'avoir l'accès des méthodes électroniques pour communiquer avec les patients qui sont fait tester. Alors, pour la sécurité, les gens qui inscrivent pour le site web, il faut avoir un mot de passe. Et alors, ça, c'est protégé. Et alors, à ce moment-ci, moi, j'ai pas d'inquiétude sur au sujet de la possibilité de leur information être protégée, oui ou non. Je suis confiant, j'ai confiance dans les méthodes qui ont mis tout ça en place, alors je n'ai pas d'inquiétude.
Monsieur Roy, comment as-tu suivi cet après-midi?
Oui, merci Bruce. Celle-ci sera pour Monsieur Higgs. On sait que depuis le début de la pandémie, il y a beaucoup de choses qui se font en ligne, notamment de la télémédecine, les rendez-vous par téléphone ou en téléconférence pour les médecins de famille, entre autres, des choses comme ça. Je sais que c'est des choses qu'on voulait voir depuis longtemps, mais que la pandémie a accéléré un peu. Pensez-vous qu'on va pouvoir conserver ces mesures-là pour toujours dans le système de santé et donc il y aura un plus grand accès via la technologie pour les systèmes de santé pour les Nouveau-Brunswickois dans l'avenir?
Absolutely. I not only that, I hope that we'll be able to continue what we've learned here and expand upon it. It would be a shame for us to move back from what we have experienced during this, the innovation we've seen within the civil service, the innovation within others that we're working with to provide services inside or outside of government. I think that the future is e-health, and it is extremely important for us to be able to meet the demands that are facing our province. But we have seen how important it is to work together and on a common focus. And I'm excited about that because we're working across departments like we've never worked before. So it isn't good enough for, it's moved to someone else's department. It's actually, it's our problem as a collective whole. And I reiterate quite often that I feel the same way about the COVID Cabinet Committee, because right today, it's not a matter of it being anyone's idea. It's a matter of it being, our party, our unity party of 4 that basically is focused on doing what's necessary for our province.
Thank you, Premier. Merci, M. Bois-Comeau. Laura Brown, CTV.
Hi, Premier. I'm wondering, I know I'm going to be that person that asks the timeline question, but PEI just came out and said that they are looking at easing some restrictions by May 1st. And I'm wondering, I understand the nursing home, schools, the borders will likely remain closed to visitors, et cetera, for the foreseeable future. But are you thinking that potentially restaurants could open, shopping malls could open by mid-May?
Well, I think that in the process of what we have, our statistics continue to be good the way they are. And I want to make it clear it's not a race between, PEI and ourselves or another province. It's what we feel in New Brunswick we can manage and not go back, like not get into a situation that we move too quickly, and as a result we find ourselves regressing in a number of cases. So the point is that as we go through one step after another, it'll be, can we do this in incremental phases that help our society realize that we're moving forward? Can we put a path forward based on some trigger points that would say, if we meet this goal, then it allows us to go this next phase? And that's obviously that's working very closely with public health and what we see as acceptable risks and what are not. So in a nutshell, are we able to do anything that moves us the bar? And I would say, the continuation of the numbers that we're seeing right now would mean yes, indeed. And the timing would reflect just what we see this week. And as I say, we're very focused on internally in the province. But at the end of the day, with whatever business moves forward and opens, they will have to respect the new normal guidelines. So it's not opening as they closed. It's opening with a new norm here in New Brunswick. And that new norm is respecting the public health guidelines. So we do not have a resurgence. And that new norm will be in place until we get a vaccine. So I think the new norm will become normal at some point, but that's how we have to start up, is reflecting and meeting the public health guidelines.
Thank you, Premier. Ms. Brown, do you have a follow-up today?
Just very quickly, follow-up to that. Should you foresee gatherings of, say, 5 people to be allowed outside at some point in the near future? And by that, I am wondering within the next month, do you have a date in mind where you would allow some of these things to begin to happen?
No, I don't, but I know that Dr. Russell, with her colleagues nationally, is working very closely to give us some guidelines and guidance in that area of what would a gathering look like. But I think what's safe to say, any mass gatherings in our province, even considering that before the fall and beyond, is really not in the cards. But if you think of some different facilities, you think, can they respect the safety guidelines, the social distancing guidelines? That's what the onus is going to be. Can they do this? And so when we say, okay, now we think this works, like the gardening, opening up gardening centers here back a week or so ago, the idea was you need to respect the guidelines in order to open. We know this is the season. We want people to, get back into outside in their yards and gardening. What other activities can we do? And we'll methodically do this in a way that people can respect the new norm. And once it becomes more of a habit, I think people are aware of the concern. They want to ensure we don't regress. They'll respect the new norm, and that'll allow us to move at whatever pace people are compliant with kind of the last move.
Thank you, Premier. Thank you, Ms. Brown. Silas Brown, Global TV.
Hi, Premier. To kind of piggyback off of this, as you begin discussions with your colleagues on the the all-party cabinet committee around creating a sort of roadmap to recovery, as you called it. What are the primary things that are going to need to be discussed at first? Is it going to be things around what restrictions can we lift to allow what sort of businesses to open, or is it going to take the form of, what sort of aid packages can we be creating for businesses? Where do you see discussions centering kind of at the outset here?
Well, first and foremost, as our target has been, we must protect the health and safety of our citizens. So we have to meet the public health guidelines as we look at any movement to reopen our economy. And it is a process, we know, where it's a balanced approach, but we don't have to sacrifice one for the other. I think as we move, as we do open things, there's always different levels of risk, but the overarching requirement will be to follow and meet the public health guidelines. And then we work with companies to say, okay, what companies can do that? What businesses can reopen and respect that? And then we're looking today at companies in their financial situation and looking at the combination of our support with the federal government support, how many can get up and running and get back to the new norm quickly. We need to bring New Brunswick back. We need to create a province that's gets back to its economic viability and its lifestyle, and people feel that sense of purpose and the benefits that exist from living in our province. I believe our new norm is going to create new opportunities, and I believe New Brunswick's going to come back bigger and better and stronger than it did pre-COVID.
Do you have a follow-up this afternoon, Mr. Brown?
Yeah, just on returning to the topic of potential aid packages. I know you mentioned that you're going to have to kind of look at the financial situations of various sectors and companies and where the assistance that you've already announced will align with the federal government. But do you anticipate having to create some sort of further provincial program or provincial aid package to aid businesses?
Well, certainly, we have a program for medium and small businesses that is an interest-free loan. We've done several things in terms of reducing their cost structures today and defer. We'll work with each one, like on issues around current costs, whether it was WorkSafe, which we deferred for 3 months, and whether it be remittances that go federally, whether it be property tax, in terms of looking at what their particular situation is like. We want to see companies recover. We know that there will be losses there. There will be companies that likely won't come back from this. So we won't be naive in the process, but our goal is to have a rebuild of our province in a way that's sustainable and long-term. I've said that I'm trying to balance what the federal government offers, what we can offer, but at the same time being cognizant of how much money our province gets from federal transfers. And if you look at the federal situation right now, and you look at the collapse of the oil industry in Alberta, and that was, I think, 30 or 40% of the revenue source for Ottawa, it's like, well, are our transfer payments going to be impacted as a result of this? So, it's easy to live for today, but I am building and working with my colleagues to design a province for tomorrow. We've always had a focus on bringing people home to stay here, having a future for our citizens to stay and work and live here, having our young people have their families and stay here. So that focus hasn't changed. And I'm not going to get in a situation, and I'm sure as my discussions I've had with my counterparts on the COVID committee, the cabinet committee, it's like we can't lose sight of what we do today and the impact that has tomorrow if we let this get out of hand on us. So I'm pleased that we're all thinking in the same vein there. We're in this for the long haul, and we'll do what's necessary to ensure we get there.
Thank you, Premier. Thank you, Mr. Brown. Andrew Watt, Telegraph Journal.
Thanks, Bruce. My first question is to either Dr. Russell or the Premier. There's a lot of talk here about reopening and recovery. I'd like you or both of you to speak about the psychology of reopening and then potentially having to reimpose these restrictions. Are you worried about that as we move ahead?
I think I would be worried if we weren't already aware that that will be a challenge, and if we weren't already thinking about how to communicate that very clearly and effectively ahead of time, so that people understand that, again, until we have a vaccine, whatever measures we have in place currently, we may have to reintroduce depending on our numbers, and our numbers can change very, very quickly. So we are working with our counterparts at the national level, so the Special Advisory Committee with all the Chief Medical Officers of Health from the country, and also Public Health Agency of Canada, Health Canada, and the Chief Public Health Officer of the country. So we're trying to establish very clear frameworks around how to make the decisions of when to release measures and when to reimpose them. So that will be a recurring theme and a cyclical pattern that we expect to see. And again, setting people's expectations for that to be part of the new normal, that yes, we'll reestablish some parts of society and some parts of the economy, knowing that at any point in time, if the numbers don't look good and they're going in the wrong direction, that we have to reestablish the measures that are in place right now until things are manageable based on the criteria that we're determining to be, again, criteria around the numbers, the type of transmission, hospital availability and rates of admissions, and all of these things. That's what we're talking about at the national level right now, and that's what we're planning to incorporate into our own recovery plan here in New Brunswick.
Thank you, Doctor. Mr. Waugh, do you have a follow-up today?
I do, thank you. Again, to Dr. Russell. Dr. Russell, you're talking a lot about your counterparts federally and obviously from the other provinces. I see British Columbia yesterday expanded its testing criteria to anyone with symptoms. I'm just looking, given the numbers in New Brunswick, Prince Edward Island, and Saskatchewan compared to the rest of the country, you have some of the other chief medical health officers kind of asking you, like, how did you do it and how can we emulate what you're doing here?
You mean in terms of how we were able to flatten our curve?
Yes.
Well, actually, we had a discussion about that this morning because I have several meetings in the morning. One is the pandemic task force, and we were presented with some new modeling around our current numbers, and the question did come up, like, how did we succeed? How did we get here? And I think there's probably a lot of factors, and one of the things that we considered, among many things, I mean, again, a lot of things had to go right at the right time for us to be where we are, including a lot of dedicated people doing a lot of hard work. Some of it can be around the fact that some jurisdictions had super spreaders in terms of people who shed a lot of virus and infected a lot of people. So I think that in Newfoundland, I think 80% of the cases came from the two funerals that happened over a weekend. So again, we were fortunate to not have that kind of an event. But certainly it is clear that other jurisdictions have noticed our work. We are being asked to share some of our recovery phase information that we are working on. Again, we're working in concert with our counterparts at the national level, but some things we've discussed here with our own medical officers of health. So we have a group of 7 medical officers of health. We have a team of epidemiologists who are also contributing to those discussions. So analyzing the data that we have here in New Brunswick, using that data to make our own risk assessments based on the guidance from the national level, from the Special Advisory Committee and Public Health Agency of Canada. So there's quite a bit of thought that goes into what we are doing collectively here in the province, but also collectively as a country. So we're all learning about this together, and we're all in this together. So it is very reassuring to have our counterparts sharing all that information, as one province may be ahead of another province in terms of dealing with certain situations. So we're constantly able to share that information and constantly able to learn from each other. And so that's been very, very positive. So I think we respect each other, and we respect the fact that each province is dealing with their situations in the best possible way they can with the resources they have, and maximizing that sharing of information is obviously helping each and every one of us.
Thank you, Doctor. Thank you, Mr. Wall. Colin McPhail, CBC. Alan?
Hi, Bruce.
Yeah.
Hi, sorry about that. This is a question for Dr. Russell. Dr. Russell, I'm curious about testing and how that plays a role in the recovery plan, and if there will be any testing of the asymptomatic, and if so, who do you want tested first, whether that's for disease or antibodies, before you're confident in lifting restrictions?
So that has a few different parts to the answer. So I'll start with the first part, which is for us to use the data we currently have around our case numbers and the type of transmission, we will have to continue to have the same level of testing that we have right now in terms of percentages and raw numbers. So whatever we need to do to maintain the level of testing we have now is very, very important. So let's say we're on average testing between 300 and 500 people a day. We need to continue that amount of testing to allow for the data that we have to continue to be relevant and to be accurate. So for right now, we have people being tested who have 2 of the 5 symptoms. We can reduce that even further to keep those numbers up. So we can reduce it down to 1 symptom out of 5. With respect to asymptomatic transmission, or asymptomatic testing rather, we actually have several plans in place to do some to make sure that we have rapid testing available for different vulnerable populations, and we are working with a working group on that. And then the prioritization of some of the asymptomatic testing, like if we're going to proceed with asymptomatic testing, who should be tested, what conditions, and when and how. So those are being discussed right now. So it definitely is a plan to be incorporated into our recovery plan moving forward, but testing is a crucial element of the recovery part of this. So whether we, as we continue to cycle through the measures that we have in place now to more relaxed measures and then having more strict measures put in place, all of that will be dependent on the data, and the accuracy of that data will require a certain level of testing to be maintained throughout this.
Thank you, Doctor. Mr. McPhail, do you have a follow-up question this afternoon?
I do, thank you. This one's for the Premier. When you mentioned earlier when some sectors were going to reopen, not every business within that certain sector would reopen overnight, and it might be gradual for some. In our reporting, we're hearing businesses have a lot of questions about what measures and guidelines and requirements they'll have to meet to reopen, and if that requires any infrastructure that they'll have to set up. And so I'm curious about how much notice that they'll be given here, and how that will play out so they can reopen in an efficient and safe manner.
Well, certainly the requirements are going to be pretty straightforward in relation to what we have heard now for many weeks in relation to following the rules around the public health requirements. So those will be first and foremost, and businesses could today be thinking about, okay, what would I do to practice social distancing? What would I do in my operation to ensure that people can come and go safely and not have any additional risk to protect and be able to protect their employees? Would they need to wear masks? Would they need special clothing? So businesses today could be thinking about that. It won't, we will give adequate timelines, but I think that every business right now wants to get back up and running, and their requirements to do so would be quite well known, even though we will make it very clear in that regard, and we certainly will give adequate timelines. But it'll be the business that'll dictate whether they feel their timeline is, or when and where they can get up and running. Getting employees is going to be a part of that. Many have kept their employees through the federal program and the subsidies, so they're ready to go. We know that the program was there to ensure that those businesses were ready to go and start up again. So I'm hopeful we'll see that. And we're doing analysis right now on how many of our businesses are restricted or not running at all. And we know certainly certainly food service restaurants in that regard were hit very hard through this, and those will be challenges as we go forward.
Thank you, Premier. Thank you, Mr. McPhail. Voilà la fin de notre mise au jour. Merci beaucoup tout le monde. That concludes today's update. Thank you very much.